Welcome to our channel, where we explore innovative solutions for mental health. Today, we dive into the fascinating realm of virtual reality, VR, and its role in treating anxiety disorders. If you're intrigued by cutting-edge technology and its potential to improve lives, stay tuned. What is virtual reality therapy? Virtual reality therapy, VRT, uses computer-generated environments to create realistic, immersive experiences. Patients wear VR headsets to enter 3D worlds where they can face their fears in a controlled, safe setting. This modern approach is changing the way we treat mental health conditions, especially anxiety disorders. How VR therapy works. 1. Exposure therapy. Traditional exposure therapy gradually exposes patients to their fears. VR takes this to the next level by immersing them in lifelike scenarios. For instance, someone with a fear of flying can board a virtual plane, gradually becoming accustomed to the experience. 2. Cognitive behavioral therapy, CBT. VR can enhance CBT by allowing patients to practice new coping strategies in simulated environments. They can rehearse social interactions, public speaking, or confront phobias, all while receiving guidance and feedback from their therapist. 3. Relaxation techniques. VR can create calming environments, such as a serene beach or a peaceful forest. These virtual spaces help patients practice mindfulness and relaxation techniques to manage their anxiety. Benefits of VR therapy. Controlled environment. VR therapy offers a controlled environment where therapists can adjust the intensity of exposure. This ensures that patients are neither overwhelmed nor under-challenged, leading to more effective treatment. Accessibility. VR therapy can be done remotely, making it accessible to people who might have trouble traveling to a therapist's office. This is especially beneficial for those with severe anxiety or agoraphobia. Realism. The immersive nature of VR creates a sense of presence that traditional methods can't match. This realism makes the therapy more effective as patients' reactions in the virtual world closely mimic those in real life. Safe exploration. VR provides a safe space to explore and confront fears. Patients know they can remove the headset at any time, which helps reduce the initial fear of facing their anxieties. VR therapy for specific anxiety disorders. Social anxiety disorder. Social situations can be daunting for individuals with social anxiety disorder. VR therapy can simulate various social interactions, from casual conversations to public speaking, allowing patients to practice and improve their social skills in a low-risk environment. For example, in a virtual party, patients can practice initiating conversations, reading body language, and maintaining eye contact. These simulations help build confidence and reduce anxiety in real social settings. Post-traumatic stress disorder, PTSD. For those with PTSD, VR can recreate traumatic events in a controlled way, allowing patients to process their experiences safely. This exposure, combined with therapeutic support, can help reduce the intensity of PTSD symptoms. In one scenario, a veteran with PTSD might relive a combat situation in a safe, controlled environment. The therapist can guide the patient through the experience, helping them process emotions and develop coping strategies. Phobias. Whether it's fear of flying, heights, or spiders, VR can recreate these scenarios with high fidelity. Patients gradually face their phobias, learning to manage their reactions and decrease avoidance behaviors. For instance, someone with arachnophobia can start by observing a virtual spider from a distance and gradually move closer, eventually interacting with it. This gradual exposure helps desensitize the patient to their fear. Generalized anxiety disorder, GAD. Individuals with GAD can benefit from VR environments designed for relaxation and mindfulness. These virtual spaces provide a break from everyday stressors and teach techniques to manage anxiety in real life. A patient might find themselves on a virtual beach, guided through a meditation session. The sights and sounds of the ocean help induce a state of calm, making it easier to learn and practice mindfulness techniques. Research and efficacy. Numerous studies have demonstrated the effectiveness of VR therapy for anxiety disorders. For example, Research published in the Journal of Anxiety Disorders found that VR exposure therapy was as effective as traditional exposure therapy for treating phobias. A study by Freeman et al. In 2018 showed that VR can significantly reduce symptoms of social anxiety. Participants who underwent VR therapy reported lower anxiety levels and increased confidence in social situations. Another study from Oxford University found that VR therapy significantly reduced anxiety and distress in patients with psychosis, showcasing its potential beyond just anxiety disorders. Real-world applications. 1. Overcoming fear of flying. Meet Sarah, a frequent traveler who developed a debilitating fear of flying. Traditional exposure therapy wasn't practical, so her therapist recommended VR therapy. Using VR, Sarah could virtually experience takeoff, turbulence, and landing, all while in a safe environment. Over time, she became more comfortable with the sensations and eventually managed to fly without severe anxiety. 2. Managing social anxiety. John struggled with social anxiety, making everyday interactions a challenge. VR therapy allowed him to practice small talk and public speaking in a virtual setting. Gradually, his confidence grew, and he started engaging more in real-life social situations. 3. PTSD treatment for veterans. Veterans with PTSD often struggle with traditional therapy methods. VR therapy has shown promise in helping veterans process their traumatic experiences. By recreating combat scenarios, VR allows veterans to confront their past in a controlled environment, reducing the severity of PTSD symptoms. Challenges and considerations. Cost. While VR technology is becoming more affordable, the initial investment can still be high. This includes the cost of VR headsets and developing or purchasing therapeutic software. However, as technology advances, costs are expected to decrease, making it more accessible to a broader audience. Accessibility and training. Not all therapists are trained in using VR for therapy, which can limit its availability. However, as more professionals recognize its benefits, training programs are expanding. Organizations and universities are starting to include VR therapy in their curricula, which will help increase the number of trained therapists. Individual differences. Not all patients respond to VR therapy in the same way. Some may find the technology overwhelming or disorienting. It's essential to tailor the approach to each individual's needs and preferences. Therapists must be vigilant and ready to adjust the therapy plan as needed. Technological limitations. Current VR technology is not without its flaws. Issues like motion sickness, low-resolution graphics, and technical glitches can hinder the therapeutic experience. Continuous advancements in technology are needed to address these limitations. The future of VR therapy. As technology advances, the applications of VR therapy for anxiety disorders are likely to expand. Improvements in VR realism and interactivity will enhance the therapeutic experience. Moreover, integrating biofeedback and artificial intelligence could personalize therapy even further, adapting scenarios in real time based on patients' physiological responses. Biofeedback integration. Future VR systems could include biofeedback sensors to monitor heart rate, breathing, and other physiological responses. This data can help therapists understand how patients are reacting to certain stimuli and adjust the therapy accordingly. Artificial intelligence, AI. AI can be used to create more adaptive and personalized VR experiences. By analyzing patient data, AI can modify the virtual environment in real time to better suit the patient's needs, making the therapy more effective. Expanded applications. Beyond anxiety disorders, VR therapy could be applied to other mental health conditions such as depression, OCD, and even substance abuse. The versatility of VR makes it a promising tool for various therapeutic purposes. Integration with traditional therapy. VR therapy is not meant to replace traditional therapy, but to complement it. Combining VR with conventional methods like CBT or talk therapy can provide a more comprehensive treatment plan. This hybrid approach can address various aspects of anxiety, leading to more effective and lasting results. For example, a patient might start with traditional talk therapy to build a foundation of coping strategies, Then use VR to practice and reinforce these skills in simulated environments. Ethical considerations. As with any new technology, ethical considerations are crucial. Ensuring patient privacy and data security is paramount. Therapists must also be transparent about the potential risks and benefits of VR therapy. Continuous monitoring and feedback can help address any ethical concerns and ensure the therapy is conducted safely and effectively. Informed consent. Patients should be fully informed about what VR therapy entails, including potential risks and benefits. Informed consent is essential to ensure that patients are making knowledgeable decisions about their treatment. Data security. VR therapy often involves collecting sensitive data about patients' mental health and physiological responses. Ensuring this data is securely stored and protected is critical to maintaining patient trust and confidentiality. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more insights into mental health and innovative therapies.